Welcome to my YouTube channel. Today I am going to talk about a very sensitive subject. I am a gynecologist and my life has gone hearing the question why the Cesarian rate is so high. I practice in rural area for about 19 years from 1987 to 2006. I ran a private nursing home and my Cesarian percentage was 10%. I didn't have any registered cases with me. Nearly 90% cases were unregistered, referred to my center as a last resort when the normal delivery did not occur. They came from primary health center and from the houses and the small doctors. So it was actually expected that my Cesarian rate will be much more higher, but it did not. I have only 10% Cesarian. Because there is a pressure from the society, the rural farmer and poor society has a tremendous pressure on me not to go for Cesarian. And I tried my level best, toiled hard to avoid Caesar, of course, keeping the mother and the child safe. So it was 10%. Now the Cesarian rate is much higher in cities and all across world. Well, we shall go into the roots of the problem. What exactly do we mean by higher Cesarian rate? The World Health Organization actually expects 15% Cesarian rate. So if the 100 patient comes for delivery, not more than 15% should be undergoing Caesar. But what is the reality? The reality is WHO itself notices that the 7% Cesarian rate in 1990s have increased to 21% all across the globe in 2023. And in India, the NFHS data, the government data, is a startling data. Well, in private healthcare sector, the Cesarian rate today is 47.4%. One baby out of two delivered in private hospitals in India comes out by Cesarian. While in contrast, the government hospitals, today the NFHS says that the Cesarian rate is only 14.3%. And it knows that in some states it's more than, and cities it is more than 60% and above. Well, this exponential rise is not only restricted to India. For example, same trend has been observed, as WHO has noted, across globe. Now Turkey has 54.4% Caesar, South Korea 47.5%, and UK, to my surprise, where it is a national health service, there is no private sector involved at all, and so one cannot accuse UK health system to go for Caesar out of greed or money. But still, it is around 30%. 30%. And on the other hand, the United States, where strict protocols are enforced, so completely in the private healthcare sector, the Cesarian rate is around 32.3%. So the trend is increasing all across the world, and WHO expects that by 1930 to 2030, the rate average will go to 29% from 21% today and to up to 63% in some countries. It is that dire. And if we go by cities and states, in Telangana, the Cesarian rate is 60.7%. In Kerala, it is 42.4%, Andhra 42%, Lakshadweep 31%, Jammu and Kashmir 41%, Goa 39.5%. And if we look to the bottom states, the Meghalaya is lowest, 8.2, Bihar 9.7, Mizoram 10.8, Assam 18.1, and Himachal Pradesh 21. The rate, if we focus on to the private sector, the rates are much higher, much higher. For example, in Tripura, it is whooping 87.1%, 87.1%. And as I told you earlier, it is 47.4% average of Indian private healthcare sector. Now we compare to Brazil, it is 80 to 90%. It's open high. So the answer to the questions, has Cesarian rate risen? Yes, it has. It is much more in private healthcare sector in India. Every one baby out of two comes by Caesar in private hospitals in India on average. Well, what are the reasons for that? Why such a surge? First of all, there is a racial variation. The size of the pelvis matters, right? So it can be, white women have lesser number of cesarean. Asian Hispanic has much higher odds because the failure of progress of the labor and because of the small pelvis. And add to this the malnourishment, especially in India and across, because malnourishment keeps the pelvic bone short, small. In past, say 30, 40 years back, 40, 50 years back, the cesarean was mainly done to tackle the danger to the mother. But now a report has come that today, if out of 100 seizures, 1.4, 2 seizures are only done for mother's sake, to save mother. 98% seizures are done to save the child. And that is the real key to why the Cesarian has increased. Because when the child suffers for fetal distress, extraordinarily prolonged labor, oligohydramnios, very much like IUGR, and fetal distress, primary coming with breech, the first pregnancy coming with breech, of course transverse lie, severe IUGR and distress, growth reduction, and the expected date of delivery has been surpassed. Well, these are the general indications for which the cesareans are done for the fetal well-being, which is taking 98% of all the seizures. One more thing I want to caution. I see a lot of reports, many reports of the sonography reports of the pregnant woman in the late pregnancy with a cord around the neck. The sentence is, cord around the neck is noted, and that sentence is underlined with the red in pain, danger. No, please note, very, very rarely cord around the neck is the cause for fetal distress. I myself have delivered so many babies with one, two, three cord around the neck. I mean, it's not like when you have a baby, your baby has a cord around the neck. It is like a, noose of the baby is going to get hanged. No, it's not. That picture is wrong. That visual impression is wrong. In very few cases, when the cord around the neck is there, the baby will get distressed as the progress of the labor happens. But nobody in the world can say to you that this baby will go into distress and this will not, and most probably it will not. So never rush for the planned seizure when for this single sentence, underline reading. No. Discuss it with your obstetrician, and I am sure that he or she will just brush aside this. I am pointing to only one indication, cord around the neck. For the others, there are different. But then, as I say that we are 98% of the seizures today are done to save the child. There are some realities which have changed for over the 40 years in the past, say in my parents or their parents' time. There were 7, 8 children for a single woman, 2, 3 died and 5, 6 survived. So there was not much a issue of the fetal death. Now there are either mostly one or two, not more. So naturally, the focus on the child's well-being, the fetal well-being, is very sharp nowadays, very sharp. It is a sheer pressure on the gynecologist, sheer pressure. Believe me, I faced that pressure for in 8,000, 9,000 deliveries. So that is one pressure which is pushing the figure high. And it is very easy now. The technology is advanced so much. It's a blessing. But there is this side to this blessing that we know which fetus is in danger in the womb, even before the pains and when the delivery began. So as compared to past, the risk of Cesarian is taken to save the child, because we know now in last 20-30 years the anesthesia has improved, the techniques have improved, the material used in the Cesarian is much more superfine and safe. So generally there is a feeling in the doctors as well as in the people that Caesar is safe. That feeling is also a cause behind pushing the Cesarian up. One more factor I have noticed, even in my daughter or even in the daughters of my friends and relatives, this young generation has never suffered a pinprick. So the pains, labor pains, are of low quality. There is no study as far as I know about this factor, but it is to be done. But it is a usual phenomenon anecdotally experienced by doctors, that as compared to my patients in the rural area who were hard labor, hard work, pain, suffering, they are at more ease to handle the labor pains, and the pains were good as compared to the pains in the top urban, educated, career-oriented women. I am not blaming them, but this is just one reality which is pushing Caesar high according to my anecdotal experience. And the most important point is the age at which the woman delivers first child is increasing. Now we get 30 years, 32 years. In my rural practice, 30 years is the age when Patient has completed 2 deliveries and has come to me for sterilization operation. Here in the cities, the woman come for the first child, for the first delivery. Especially the data shows that after 35, 52%, 53.2% of the deliveries go to the caesar. So increasing age is one of the reasons. Another is most important practical reason may not be justifiable is the convenience of the doctor and convenience of the patient. Well, now we are in the fast forward age. Everything is fast, and obstetrics is a dull practice. You have to have patience. I remember in my practice in rural area, I waited for 3 days for one single delivery because the baby was fine, the pains were improving. I waited, and on the third day, after, I mean, at the end of the third day, I delivered normal baby. But please answer the question to yourself as a patient or as a relative, or even are you ready to wait and suffer pains for 33 long days? Honest answer will be no. And even the doctors are not ready, not in position. They don't have that intense facility to monitor for 3 days. So when there is a rush with a slight indication, you go for cesarean. And doctor and patient convenience, I'm talking. There is a concept now emerging as an office delivery. In good old days, and as we know, we wait till the labor pain starts. Of course, that reduces the cesarean percentage much lesser. But nowadays, the nuclear family, no family support, both are working till the last day. Doctors want a daytime activity. Well, they call the patient, and the patient happily goes for induction of the labor without pains at a designed day, say at around 5:30, 6 o'clock. For doctor, no jhanjat for overnight. For a patient also, very planned delivery. And well, if you induce the patient, 50% deliveries will occur normally. But there will be 50% seizure. So that office deliveries also increase. And it has been definitely the more educated, the more affluent, the more career-oriented women and the relatives, the more demand, push for the Ceserian. I remember one case. I told you that I waited for 3 days in the rural setup, but in the urban setup, when I conducted one delivery, the patient was software engineer and very educated and everything fine. But she was admitted at 6 in the morning, and when the 7 p.m. there was a very palpable uneasiness and anxiety in patient as well as relatives. And every 15 minutes, relatives will come after me and say that doctor, if you think Caesar is you have to do Caesar, please go ahead. We will not object, but we don't want any harm to the baby. Now this is a panicky pressure from relatives even on me. So on the first small indication, I rush into Caesar. This is the situation today. And this has increased to such an extent that I was rather surprised, very surprised, to see the UK protocol giving accent to, they agreeing to the condition of Caesar on demand. Well, one patient came in my 20 years who said, I don't want to go for labor pains, I don't want anesthesia, I want planned Caesar. I rejected that offer. But now in UK, where you cannot accuse UK of monetary gains or like that, but still the condition has been improved. if the patient comes to the doctor and says that I want Caesar on demand, I mean, they have put the clause that that patient should be counseled intensively and all efforts should be done to make the patient away from her decision. But even if after the counseling, if she determines, I mean, yes, then you have to, I mean, do the Caesar on demand. And if the gynecologist is not ready, refer her to another. Honestly, this was something unsettling for me, and I think most of the gynecologists and obstetricians. I mean, our whole life purpose was to keep mother and baby safe and avoid Caesar. Well, that is the situation today. And the basic assumption, as I notice, even the patients and the doctors, is well, Caesar is safe. Caesar is not safe. Vaginal delivery is much more safer, much more safer. Even when Caesar is an operation, there is an anesthesia risk. I mean, one patient can die out of anesthesia. Why take the risk? There are risk of wound, healing, the perioperative period and pain and I mean peristalsis and paralytic ileus and the long recovery time, the wound, the lesions, the infections. No wisdom in taking all those things in favor of Cesarian if vaginal delivery is possible. Some points have been also noted that postpartum depression is much higher in Cesarian. And baby, no, come on, baby is not much safer. Actually, vaginal baby is safer than Cesarian baby. Cesarian babies suffer from respiratory illnesses because his thorax is not squeezed, the lungs are not squeezed. And one more thing it has been observed that the Caesar baby lacks the good bacteria in his or her stomach. When the baby passes through the mother's vagina, it ingests the normal bacterial flora from the vagina, which is helping the vagina. It is a healthy flora which helps the health of the baby. So, यह है सब सीजरियन का पुराण. This is what Cesarian is today. Please come out of impression, please, that Cesarian is safer and cool as vaginal delivery. It is not. And but this is about you also now. But also accept one reality, as we saw in UK and US. UK where protocol-based Cesarian or deliveries, the percentage is 32%. So assume that rationally in today's world, for all those reasons which I discussed, we should expect 1 in 3 babies as a Cesarian baby. All pregnant women must digest this fact. Be patient, pray, but be ready for this. And don't blame doctors if it is that percentage. But what about exponentially high percentage in India? 60%, 70%. Wow, I have no answer. No doctor or no patient can have any answer. With all permutation combinations of the causes discussed above, the genie is out of bottle, and we can't put it back. We should actually, in Western countries, a very good tradition has begun, very practice has begun. They call it as a birth counselor. It's a sophisticated midwife. Even in India, there are some. Actually, what has happened in India, paramedical staff is lacking. We don't have skilled midwife. So all load to deliver the patient comes from the doctor. It is unhealthy. Unhealthy for the doctor's health and unhealthy for the Cesarian percentage because we get impatient. So ideally, the trend should be like this. The entire midwife or the birth counselor very trained, very connected to the specialty unit and referral systems very quick. This system will safeguard the initial labor from the doctors and keep vaginal delivery as a motive. And in the first step, when there is an obstacle, may not be the distress, but obstacle, the patient is rushed and doctors take over. This is the ideal situation to reduce the Cesarian rate and go for more vaginal delivery. I hope that this system is adopted in India as well. But there is one but. India lacks from the strict regulation and governance mechanism as in UK, US. I mean, no doctor in UK or US will dream of going out of protocol. They will be punished. In UK you are taken to the accountant, and in US, I mean, insurance company will not approve the insurance. In India, there is no system, no system. Alliance of Doctors for Ethical Healthcare, which I am a member of, we approached the Rajya Sabha Committee for National Medical Commission and requested a separate governance unit in National Medical Commission to make ethics and the protocols accountable, doctors accountable. And mind you, corporate hospitals are not governed by National Medical Commission. So nobody can control them. Nobody. The individual doctors are apparently controlled, not on the ground. And why Cesarian? Everything is exponentially high in Indian private sector because there is no big brother is not watching. A huge mass movement is required to make government enforce strict. I mean, our pleading that separate unit like on the terms of General Medical Council in UK should be established in India to govern and make doctors accountable for the mischief in ethics as well as mischief in protocol was not accepted. Was not accepted. The nationwide roar should come to pressurize our political system of all parties to make it happen. And unless then, well, enjoy half percentage of Cesarian, angioplasty, cataract. India है भाई, private sector है, corporate world है, enjoy. So don't blame only Cesarian for that. But anyway, please make this video viral, and I'm sure the gynecologists themselves will use this video for the educating their patients. Make it viral, subscribe to my channel, and thank you for visiting my channel.